just want to say that this is really emotional for me. I didn't think it would be this difficult, and I am speechless at how many people are sitting out in our audience today, because we all know how much Medicaid matters, and it's going to be like preaching to the choir. So I appreciate that I have an opportunity to speak. It's rumored that Albert Einstein was one of the first people that ever said that the definition of insanity is doing the same thing over and over and over again and expecting different results. And they call us crazy. They're cutting our funding again. Do they think that cutting funding and not being prepared for a fallout that we just heard Scott talk about, that people go to the hospital, they then seek institutionalization? Also, we have to think about what happens when they get locked up in our juvenile justice system or in the justice system. That costs money. Cutting services won't necessarily save us money. I've been asked to speak today on volunteerism and the suggestion that possibly volunteers could step up and take the place of PSR workers and those who provide developmental services, DD services, pardon me. Two main points that I'd like to highlight today. First is that the community mental health workforce, and that's how we refer to both of us together, have to meet rigorous qualification standards to provide services in the state of Idaho. And then the second is that if we have a volunteer workforce, this will be an untrained, unsupervised. Potentially these individuals won't have the skills unless they were former PSR workers or DD workers who are now willing to volunteer their time. Community mental health workers are expected to be competent in community organizing, resource development and acquisition, advocacy, public education, medication education, crisis prevention, as well as be scaled in a myriad of rehabilitation counseling methodologies. We're also called upon to use these skills in very intimate settings. Sometimes these settings are very public, and volunteers not knowing how to handle the situation means that they might not be culturally competent. That's why we have trained professionals who step and provide these jobs and these services, because they know how to make sure that if I'm having a problem because I'm bipolar, they work with me. They don't stigmatize me. They understand that maybe I'm just manic today and need to make sure I don't drink that coffee. So, let's talk about this. Currently, any candidate seeking employment right now as a community mental health workforce is required to, 1, pass a criminal background check, have obtained at least a bachelor's degree in some human service, in a limited number, pardon me, they just changed that, in a limited number of human services field. Also, they've just now added certification requirements. Each individual is required to adopt, study, and abide by a code of ethics that is based on the foundation of their training, which is we will do no harm. We'll promote and ensure safety. We'll do nothing to diminish the integrity of any person or thing. Refrain from exploiting based off privilege and position, power or knowledge, and avoid unnecessary suffering. And we always optimize recovery. We are focused on the strengths, which is different than what volunteers are. This is the training that we've had. It's a strengths-based approach. This is something that our volunteers will not be equipped for. Mental health needs requires uniquely trained individuals. Inevitably, money will have to be spent to overcome the training deficiencies of those who are left to fill the void. In the long run, it'll be more efficient to support those individuals who are skilled now on the workforce, in the trenches, working with us. We will save more money if we support us. The second point I speak to, I referenced earlier, is the oversight of volunteers. This is important because now not only are we putting our volunteers at risk, but we're putting ourselves at risk, because we're working with untrained individuals who don't necessarily know what's best, but at the same time, they might not recognize when they just need to get out of our space, because we just need to be humans as well. Volunteers lack professional supervision, which is what PSR workers and DD workers have to have weekly. There's no way to track, measure the outcomes of a community mental health infrastructure if it's based on volunteers. According to the Disability Rights of Idaho webpage, volunteers would need protection from exposed risk for themselves, for the people they serve. They need access to a network that includes supervisors, clinicians, and consultants. They need to be familiar and connected with multiple agencies and know how to efficiently coordinate with community resources for their clients. Sounds like what PSR workers do now, and developmental delay specialists, pardon me. Volunteers will also frequently need to be replaced because remember, there's a high burnout because they're volunteering their time. They need insurance protection from liability or injury, and these things are not readily available from local churches or families. Disability rights continue. A large contingent of qualified willing volunteers will not spontaneously arise from the elimination of DD and PSR services. And if we are that confident that volunteer assistance could replace these services, we should be willing to guarantee that a person's services will continue until adequately trained service members are able to replace them, or church members or family members then can replace their services, and that will be restored so volunteers can take the place. Those who propose the cuts cannot make that guarantee. Instead, they are willing to put important mental illnesses on the back burner. We're here today to say that these communities cannot be placed on the back burner. Mental illness support services require professional expertise and a professional commitment to care. The most disturbing thing is there are alternatives to these drastic funding cuts, such as a 1 cent increase on sales tax. There was temporary increase in sales tax by the Governor Rush, who stepped in, and it was only a temporary increase, and once that funding was replaced, he removed that temporary increase. There could be an increase on tobacco taxes. There are alternatives, which would be a 1 cent increase. These alternatives exist to drastic funding cuts. We will pay an increase in taxes. The question is, will we pay it now or will we pay it later? Right now, it's going to require us to collaborate and a willingness to create and develop a strategic plan that is based on providing services to Idaho citizens that are life-saving, that are cost-effective, and are based on evidence-based services from a trained workforce community that we already have set up in status quo. We need to come together and collaborate and provide these appropriate services, not only because we have a responsibility to, but because it's the right thing to do. And before I close, I just would like us to chant Medicaid Matters 5 times, because I do feel that it's a rally, and I do think we need that element. So on the count of 3, Medicaid Matters 5 times. 1, 2, 3. Medicaid Matters!